So one of the most important findings, I think, is to make sure that the patient gets a culture of the chest, i.e. specifically the breast tissue of the chest where the implant was sitting. This is what I do on 100% of my patients, my international patients, my Canadian patients who don't have insurance. It's a nominal fee, but I find it's integral to finding out what it is and what it is not. You have to rule out mold, which is a very rare finding, but again, still there are bacteria that are associated or affiliated with breast implants. So as you will see, I have Paige, my nurse, she gives me, I open it right before, so this is sterile with my left hand. I never want to touch the skin, and I go in very tactfully. I go into this pocket, and then I basically swab right underneath the breast tissue and the chest area, and then I break it and then put it in here directly. So this has been open only but for a few seconds. And the cultures are sent for aerobic, anaerobic, and fungal. So we basically covering our bases, just making sure. This is the second culture. What I'm going to do is I'm going to go ahead and shine some light so you can see. I go in and I lift up. I don't want to touch the skin. I know this is all sterile. And I go in, swab exactly where I need to go, all the way around, and I'm getting a good sample of where the implant was sitting, because if there is mold, bacteria, whatever it may be, I'm able to get it. So I go ahead and go in and I touch. And remember, the skin is not touched at all. I do 7 layers. Sometimes I do the core prep. I cover the entire area. There is betadine all the way around except for the area where I put the incision. And as you will see again for the third time, aerobic and anaerobic fungal cultures, they go to the microbiology lab here at the main hospital.